When I became CEO, I made a solemn vow, a commitment to this community that I was going to be transparent and forthcoming with our community. So I'd like to take about 20 minutes and just cover some topics, things that were questions we've been receiving on social media, or just we know that are of keen interest to the community. I definitely will talk about obstetrical care, which I know is causing a tremendous amount of anxiety right now in our community. Kaweah Health has a mission statement. Health is our passion, excellence is our focus, compassion is our promise. Our vision is to provide world-class health care to every person, every time, for life. It's a big responsibility, and one that we take very, very seriously, but we recognize that we can do better. I get lots and lots of letters and expressions of appreciation and gratitude from our patients, from their families, talking about the wonderful, compassionate, high-quality care that they received in our hospital, in our facilities. But I also get way too many letters expressing dissatisfaction and disappointment. And that's not world-class. That's not living up to our mission statement. So I wanted to share with you some of the things that we're doing to elevate the performance of our organization, to create better experiences for you as our community, our patients, and our family members. I'll start with the emergency department, which is really kind of the face of the organization. 40% of the patients that are admitted to the hospital end up coming through the emergency department. It is an incredibly busy emergency department. This last year that ended, our fiscal year, on June 30, 2024, for the first time in our 60-year history, we saw 100,000 visits to the ED, and we're projecting that we'll have a similar number this year. It's again, the highest in record time. Before the pandemic, we might see about 65 to 70,000. I can't explain all the reasons why. We definitely have seen hospitals close, emergency departments close in our service area, but the demand just continues to grow higher and higher, and we as an organization need to change and evolve with that so it doesn't come at the expense of our patients and their families. So, beginning immediately, we will no longer not allow a patient to have an advocate with them. So there have been many times when we're busy that we've literally shut the front doors and not allowed a patient to have a family member in the lobby, in the waiting room with them. At a time that they're scared, they're anxious, they, not certain what's going on with them, they're sick or they're injured, and to have their loved ones sitting out in the car or standing outside of the building is just heartbreaking. And so we are no longer going to allow that. Even when we are at our busiest times, we will always permit the patient to have at least one family member with them while they're in the waiting room. Once they go back to an exam room, then they're allowed to have two visitors with them. And they can switch off, so it doesn't have to be the same two for their entire stay. We also are engaging a nationally renowned consulting firm by the name of Greeley. They work with thousands of hospitals across the country to improve their operations, to elevate the quality and the safety of the care that's not just being provided in the emergency department, but throughout the entire medical center, throughout the entire organization. So they will soon be coming on site, physicians, nurses, other consultants, that their singular focus will be on improving the throughput of our ED, shortening the wait times, improving the efficiency of our emergency department, those patients that need to be admitted, to get them upstairs faster, to get them through triage sooner, and to get them out of the waiting room and back into an exam room. This is fortunate but unfortunate. We still have, as an industry, we still have a tremendous shortage of healthcare workers. registered nurses in particular. We are certainly have come way down from our high water mark during the height of COVID when we had close to 250 open RN positions. We're at about 140 right now, but that's still a significant number of vacancies. We were slowly weaning ourselves off of traveler nurses, but there is no way that we can continue to fully staff our hospital without having to reach back out and bring more traveler nurses back to the bedside. So we have 73 exam rooms in the emergency department. We often are having to keep them closed because we don't have enough nurses to staff them. So we have in the queue right now between 30 and 40 traveler nurses that are looking to join us so that we can fully staff the ED and keep all 73 of those exam rooms open at all times. We are also, as an organization, kind of taking a back to basics, really refocusing our efforts on the fundamentals of providing outstanding health care to our patients and our community. And that starts from visiting our website to actually receiving services in our facilities until the billing at the very end. That entire process of the patient experience, really focusing on every aspect of it to improve our performance in those areas. We have a tremendously young workforce. Again, a result of the pandemic. We literally, as an industry, we lost tens of thousands of mostly experienced nurses that chose to leave the profession for a variety of reasons. So about 50% of our nursing workforce has less than 2 years experience. I mean, they're very competent, they're very qualified for their level of experience and their education and their training, but they don't possess that innate knowledge and skill and ability that a much more seasoned, experienced nurse has. So we are now going to lengthen the time that we orient nurses so that they spend more time in that initial onboarding to really be able to assess their skills, their competencies, and to provide them more training so that when they do hit the floor, they're feeling more confident and more skilled. We also are going to start allowing patients to have a family member spend the night with them. So that's something that we really restricted during COVID. And again, a very significant hardship and heartache on patients. And so now to be able to allow a husband, a wife, a child, a friend, a family member to be able to spend the night in the patient's room with them. And then the most radical thing we're thinking about is the complete elimination of visiting hours. Family members, loved ones can visit any time of the day, 24/7. So we haven't launched that yet. We're exploring how logistically we manage it, but we want to become a much more open, supportive hospital to families and patients. Okay. So that's our commitment to you as our community. I'll talk about obstetrical issues. Again, probably the most talked about thing going on in our community right now. This is a nationwide problem. Since between 2006 and 2020, more than 400 hospitals across the nation closed their maternity programs. In the last just couple years, in 2020 and 2021, we saw 63 rural hospitals close their maternity services, requiring moms now to drive miles and miles to deliver their babies to more hospitals located in more metropolitan areas. In California alone, we've seen 56 hospitals close their maternity services since 2012. We had 10 in 2023. We've already had 4 in 24 California hospitals, and there are 4 more that have been announced that they'll be closing by the end of November. When you look on a local level, we're not immune to that. It was back in June of this year that Adventist Health in Tulare announced that they were closing their obstetrical program. Just recently, Family Healthcare Network, which has a very large obstetrical service throughout the Tulare-Kings County service area, they just announced to their patients that they would no longer be delivering Family Healthcare Network patients, their patients' babies, at Adventist Health in Hanford. That if they wanted a Family Healthcare Network physician to deliver their baby, they would have to go to Visalia, to Kaweah Health, to deliver their baby here. And then most recently, we heard that Visalia OBGYN, who's been a wonderful medical group of obstetricians, Dr. Mark Wiseman, Dr. Lorianne Boken, Dr. Bosman, Dr. Holly Quinn, Dr. Lake, who retired not too recently. That medical group has been delivering thousands and thousands of babies for decades in our communities. But they too, like these other programs, have really been struggling to attract new obstetricians. When Dr. Lake retired, and it was really down to the 4 of them, so they made the tough decision that starting on December 20th, they will no longer deliver babies. Contrary to apparently a rumor that was out there that Kaweah told them that they could no longer deliver their babies at our hospital, that is totally false. They independently made the decision that they could no longer support a full obstetrical practice as well as their gynecological practice. Unfortunately, Dr. Bosman, if she hasn't already left, she's moving to Tennessee, leaving just Dr. Wiseman and Dr. Lorianne Boken. We were very fortunate that we convinced Dr. Holly Quinn not to leave our community. She had made a decision that she was leaving Visalia OBGYN. She had an offer in hand from Adventist Health in Reedley to join their hospital and provide services there. We caught wind of it and met with her and convinced her to stay in Visalia and to come to work for Kaweah Health, that we would support her. So on October 1st, she opened her practice in Exeter at our rural health clinic, and she will work there until we complete the renovation of a robust, comprehensive OBGYN clinic in our 202 West Willow building, the 5-story right next to the helipad. So Dr. Quinn will be moving in there. She is already accepting pregnant women to deliver their babies, but she also will be accepting women that want to have babies. So despite the certainly unsettling news and the anxiety that it's causing, our phone is literally ringing off the hook, Kaweah Health is still 100% committed to providing comprehensive obstetrical services for our community. We delivered 4,700 babies last year. We expect to deliver a similar number this year. We remain in a very solid relationship with Valley Children's Hospital. Their neonatologists staff our 23-bed neonatal intensive care unit. They oversee our 12-bed pediatric unit. And then Valley Children's Hospital maternal fetal medicine physicians. So pregnant moms that it's been determined that they have a high-risk birth, they would normally have had to travel to Fresno, see a maternal fetal medicine physician up there, likely have to deliver their baby at St. Agnes or Community Regional Medical Center. And now through that partnership with Valley Children's, we have maternal fetal medicine physicians who live and work in our community. So very, very committed to continuing with that. We are actively, aggressively recruiting for additional obstetricians, but you would think with the closure of programs across the country and in the state that there would be more obstetricians available, but they are not. And I don't know if they're retiring or moving to other areas of the country, but they still are very difficult to recruit. With the support of our Department of OBGYN, they have instructed us to reach out across the country and to potentially partner with a national laborist company. So a laborist program, which we have right now, is actually a group of obstetricians who have agreed to come together and to provide an obstetrician in the hospital, physically in the hospital 24/7, in the event, to really be on standby, in the event that a mom comes to the patient in the hospital in active labor and her obstetrician is not able to get here in time. There is a highly qualified obstetrician there to step in and deliver that mom's baby. Also, moms that don't have an obstetrician. And you'd be surprised by the number that don't, that come to the hospital for the first time when they're ready to deliver. So right now, we kind of cobbled together a laborers program with our local obstetricians, and we greatly appreciate them, but they need help, and they've asked us. There are companies like OB Hospice out of South Carolina, for instance, who we've talked to in the past. So we're working to potentially bring that additional service to our community. And I'll end with, Liz had asked me to give a big shout out to the Kaweah Health Hospital Foundation. We are just getting ready to launch our newest campaign that we have named Tiny Feet, Big Steps. So really focused on two areas of the hospital, our 12-bed pediatric unit and our surgical recovery unit on 3 East, so the east side of the hospital. These two areas treat some of the most vulnerable patients, our children plus adults that need surgery that may not be complex, but they need surgery to relieve their pain and their condition and improve their mobility. So both areas have seen really significant advancement over the last 20 years, but we have, from a facility standpoint, they have just not modernized based on what we really need today. So with this campaign, we'll remodel each of those units, creating more bed space, a more comfortable surrounding for these patients. So how's the hospital doing financially? Great question. I can't say that we're completely out of the pandemic. If you read the papers, COVID is still very active across the country. We still see hundreds and hundreds of positive COVID cases every day, every week. Fortunately, it's a lot less severe strain than Delta or Omicron or things we saw in the past, so we don't really see patients having to be hospitalized because of COVID. We certainly don't see patients dying of COVID, but it still is here. We are in what I will call the post-pandemic phase of COVID. I've shared with you in the past, if you've attended any of my monthly community engagement huddles, that over that course of the pandemic, from March of 2020 through June 30 of 2023, Kaweah experienced a cumulative operating loss of $95 million. That's after receiving $61 million in provider relief funds from the CARES Act that was passed by the federal government. If not for that $61 million in provider relief, we would have lost well over $157 million. Even with that $95 million loss, we depleted a significant amount of our cash reserves, and we had to make some really difficult, often heart-wrenching decisions, laying off staff, closing services, freezing wage rates, not contributing to our employees' 401k plans. But as difficult it was, it's been working. So I'm delighted to report to you that for the fiscal year that most immediately ended on June 30, 2024, we actually had a positive bottom line. First time that we were in the black in 4 years, albeit pretty modest, a $3.5 million bottom line. We could not survive on $3.5 million. Pre-pandemic, a good bottom line would be 20 to 25 million, which would fund our capital budget for that year, new equipment, refurbishing buildings, opening new services, and paying back our borrowed money that we've constructed the Kaweah wing. We borrowed $178 million from bondholders that we're paying back over 30 years. So that all comes from that bottom line. So we definitely are on our road to recovery, but we have a long ways to go. Unfortunately, there have been some things that have made our celebration a bit short-lived. If you've been following our state government closely. There's a couple bills that passed out of the legislature and were signed by the governor that significantly impact compensation in the state, and particularly health care. It started with the minimum wage for fast food restaurant workers that went to $20 on April 1st. That affected compensation of our dietary workers, our housekeepers, anybody that was making less than $20 an hour. And tomorrow, effective October 16th, Senate Bill 525 goes into place. That's a minimum wage for healthcare workers. So starting tomorrow, every single healthcare worker in California that, except for a few exceptions, will now receive a minimum wage of somewhere between $18 an hour and $23 an hour, depending on what kind of healthcare organization you are. If you're Adventist Health, Kaiser, Sutter, the UC hospitals, you go to $23 an hour tomorrow. If you're like Kaweah, you're a standalone hospital with a very high percentage of Medicare and Medi-Cal patients, we go to $18. I can tell you though, when your competitors right down the street are having to pay $23 an hour and you're paying $18, you run a significant risk of losing your employees to your competitors. And so we've had to go beyond that $18. We built into the current year budget that started on July 1, $32 million in pay raises. Pretty much across the board, all 5,000 of our employees receiving pay increases without really any increase in Medicare, Medi-Cal, or commercial insurance reimbursement rates. So unfortunately, after having come off a positive year this last year, we have budgeted for a $12 million loss in the current year. So again, the celebration a little bit short-lived, but we're not giving up. There actually are a couple positive things. I don't generally try to influence elections, and I don't support any individual candidates, but there's a proposition that I'll just say I'm personally supporting, and that's Proposition 35. So back in April 23, the governor signed into law what's called a managed care organization tax, where he is imposing a tax on the revenue of health plans like Anthem Blue Cross and HealthNet and Aetna and so forth. He was projecting to raise $19 billion between April 1, 23 and December 31st, 26. He promised that half of that would go to doctors and hospitals, that he would increase the reimbursement rates that we receive from taking care of Medi-Cal patients. Unfortunately, he never signed that aspect of the promise into law, only the tax, not the promise to give half of it to hospitals. And so when he was staring down almost a $70 billion budget deficit, he told us, hospitals and doctors, I'm sorry, but I'm taking all of that money and I'm putting it towards the budget. And not just for this year, but for every single year through 2026. So we weren't particularly happy about that. The California Medical Association, which represents the physician profession, and the California Hospital Association, that represents hospitals, came together and put forth the ballot initiative Prop 35 that will make that managed care organization tax permanent, so not expiring on December 31st, 26, and that approximately 98% of it would be used for doctors and hospitals, and only 2% of it would go to the state. There is currently zero opposition to Prop 35. There hasn't been a penny spent on opposing it. Obviously the CMA and the CHA support it. The governor's not particularly happy with us, but it's polling really well, appears to stand a very good chance of passing, and that will be a very positive thing for California doctors and hospitals. And then lastly, there's benefits of being a district hospital. Sometimes, you envy the private nonprofit hospitals that are able to, implement their strategies a little bit more secretly so that their competitors don't always know what they're doing. But I think being a public hospital being owned by our community and answering to our community, where you're welcome to attend, every single board member. So as a district hospital, one of the profound benefits is that we are eligible for supplemental Medi-Cal funding, like the UC hospitals. So in the past, not too long ago, district hospitals did not get to participate in any of these supplemental fund programs like the UCs and the county hospitals did. But we learned just a few weeks ago, we've been working with the state Department of Healthcare Services, who is also very concerned about declining access to care for the Medi-Cal population and the closure of maternity programs across the state. They're very, very worried. And so they came to district hospitals and said, we have an idea to increase the amount of supplemental funding that district hospitals are receiving. There are only 33 of us left in the state of California. Kaweah is the largest of those 33. So we, working with the Department of Healthcare Services and working with the federal government through CMS, we have increased the amount of this particular supplemental fund by $800 million a year. Kaweah's likely share of that is $40 million a year, and into perpetuity. It does not have a sunset date. It still has to be approved by the federal government, because 100% of it is coming from the federal government. The state's not spending anything. So these are all new federal funds, but they will be used to support district hospitals and the physicians that we work with. We are very hopeful and feel confident that CMS will approve it, likely in the spring. It goes into effect, though, on January 1, 2025, although you actually don't start receiving the funds until 2 years later. So we actually won't receive the funds until 2027, but it can't be touched at that point. So it is really a game changer for district hospitals. So many of them are on the brink of closure. Many of them have had to close their maternity programs. So stay tuned.